Due to a recent outbreak of HIV and AIDS, the National Department of Health has requested that we take the time to inform the public on this matter.
HIV stands for Human Immunodeficiency Virus. It is the virus that can lead to acquired immunodeficiency syndrome, or AIDS, if not treated. Unlike some other viruses, the human body can't get rid of HIV completely, even with treatment. So once you get HIV, you have it for life. HIV attacks the body's immune system, specifically the CD4 cells, or the T cells, which help the immune system fight off infections. Untreated, HIV reduces the number of CD4 cells in the body, making the person more likely to get other infections or infection-related cancers. Over time, HIV can destroy so many of these cells that the body can't fight off infections and disease. These opportunistic infections or cancers take advantage of a very weak immune system and signal that the person has AIDS, which is the last stage of HIV infection.
No effective cure currently exists, but with proper medical care, HIV can be controlled. The medicine used to treat HIV is called antiretroviral therapy, or ART. If taken the right way, every day, this medicine can dramatically prolong the lives of people infected with HIV, keep them healthy, and greatly lower their chance of infecting others. Before the introduction of ART in the mid-1990s, people with HIV could progress to AIDS in just a few years. Today, someone diagnosed with HIV and treated before the disease is far advanced can live nearly as long as someone who does not have HIV.
This is the stage of HIV infection that occurs when your immune system is badly damaged and you become vulnerable to opportunistic infections. When the number of your CD4 cells falls below 200 cells per cubic millimeter of blood, you are considered to have progressed to AIDS. In someone with a healthy immune system, CD4 counts are between 500 and 1,600 cells per millimeters cubed. You are also considered to have progressed to AIDS if you develop one or more opportunistic illnesses, regardless of your CD4 count.
Without treatment, people who progress to AIDS typically survive about 3 years. Once you have a dangerous opportunistic illness, life expectancy without treatment falls to about a year. ART can be helpful for people who have AIDS when diagnosed and can be life-saving. Treatment is likely to benefit people with HIV no matter when it is started, but people who start ART soon after they get HIV experience more benefits from treatment than do people who start treatment after they have developed AIDS.
In the United States, most people with HIV do not develop AIDS because effective ART stops disease progression. People with HIV who are diagnosed early can have a lifespan that is about the same as someone like them who does not have HIV.
People living with HIV may progress through the stages at different rates, depending on a variety of factors, including their genetic makeup, how healthy they were before they were infected, how much virus they were exposed to and its genetic characteristics, how soon after infection they are diagnosed and linked to care and treatment, whether they see their healthcare provider regularly and take their HIV medications as directed, and different health-related choices they make, such as decisions to eat a healthful diet, exercise, and not smoke.
Learn more about how to protect yourself and get information tailored to meet your needs at CDC's HIV Risk Reduction Tool.
Here's someone talking about their experience with the HIV disease.
I wanted to become a ballerina. You know what I became? HIV positive.
And now, to a music video created by Alex Martin and Ashley Bennick about prevention of HIV.
You know you can't risk it. Gotta wrap your biscuit. Prevent HIV. Come and save me from this disease. I don't want it, please. How can I protect myself? You gotta give me tips and help. First, wear a condom. Then you won't have problems. No more STDs. Prevent HIV. Talk to your partner about HIV. Ask if they've been tested for the disease. And if you're doing drugs, keep the supplies real snug. Locked away from your friends. Don't share the needles. And when you're having sex, make sure you use the best. Trojan is the way to go, so you don't bring a disease home. Listen to our instructions to make sure you have good function. Now this bop is over. Don't have sex till you're older.